President, I rise for a moment to talk about Sylvia Burwell, her nomination pending confirmation to be Secretary of Labor, HHS, and also to talk about the Affordable Care Act, because you can't separate the two. I have the good fortune of being on the Health, Education, Labor, and Pension Committee and the Finance Committee. The good fortune of that allowed me to twice be able to interrogate, and I use the word interrogate with understanding its definition, Ms. Burwell over issues that were important to me both in the Health, Education, Labor, and Pension Committee as well as in the Finance Committee. I found her to be articulate, forthright, straightforward, and candid, something we really haven't had from the Secretary of Labor, HHS, for the last year or so, and so I'm looking forward to having somebody in there that's going to be able to answer the hard questions. I might not like the answer, I might not agree with the solutions, but I like having somebody who has the intellect and the capability and the willingness to be communicated with the members of Congress regardless of their party. So I will vote for Sylvia Burwell to be confirmed as Secretary of Labor, HHS, and I wish her the best. No one should confuse that vote, however, for being a vote in support of the Affordable Care Act or what it's doing to health care in the United States today, and I want to talk about that for a second. Some of these things I'm going to talk about are questions I asked Ms. Burwell in the confirmation hearing. You know, when I was on the Health, Education, Labor, and Pension Committee, and we did the markup in terms of the health care bill, we met for 69.5 hours. I heard every debate on every amendment, I heard every debate on every philosophy, I heard every proposal that was made, and it became quite clear to me that the premise of that legislation, based on the President's recommendation, was diametrically opposed to my personal philosophy in terms of where government's role should be. I think the President wanted to, and it's been said by the leader, Harry Reid, recently, that he thought a single-payer health care system was the right way to go. I think the Affordable Care Act is designed to drive America to a single-payer health care system. For me, I'd rather have a competitive private sector system that's on a playing field that the government makes sure is fair and level, but that the winners and losers in health care become those who compete the best in terms of quality and service. In fact, the intent of the Obamacare Act and the Affordable Care Act has directed a lot of things to happen. 3 of them are not good. Premiums have gone up. The cost of the consumer have gone up, principally because of taxes that have been levied on the insurance industry. That's number one. Access has been more limited and more restricted based on the bronze plan, the silver plan, and the gold plan, and the differences between the exchanges. And third and foremost, there's a great uncertainty in America about what happens next, where health care is going, because the President has selectively given waivers and put off in the impact of certain provisions of the law while lifting up and actually repealing with the signature of his own signature and his own pen provisions that were in the law. So there's a lot of uncertainty there. 2 things I want to focus on from the cost standpoint. One of them is what's called the HIT tax, the health insurance tax, which went into effect this year. This year, $8 billion in taxes were levied against small and medium-sized group insurance providers in the exchanges for health care. It's an arbitrary number that was used to help determine and pay for the Affordable Care Act, and it's assessed based on a market share of the companies. Think about this for a second. The United States government is taxing health insurance providers based on their market share of health insurance and adding that cost where? To the premium that's paid by the consumer. It's been estimated that the premium cost is going to go up about $512 a year for the average consumer, just in order for the small and medium-sized group provider to pay the fine or pay their share of the tax of $8 billion. That $8 billion in 2014, in 2019 goes to $14.3 billion, and will go ad infinitum as will continue to climb, which means costs will continue to climb. Access has been restricted because a lot of people aren't playing in the system. A lot of specialty hospitals have chosen not to join narrow plans, and that's meant that specialty care to a lot of children and adults just is not available. Another problem we've had is with navigators, and I want to focus on the navigator point for just a second because it fundamentally underscores my belief in the private sector. For years, I ran a business. It was a business where we employed some employees, but mostly had independent contractors. We provided group medical benefits for our employees, but only access to salesmen who would sell group health plans for independent contractors. They got a commission when they sold the plan, when they provided the services, and the employee or the independent contractor in my company decided to buy. Well, what we did in the Affordable Care Act, or what the Affordable Care Act and those who voted for it did, it basically did away with all the salesmen in the country that were selling group medical plans to individuals and small businesses. Why? Because it had a medical loss ratio maximum of 80 or 85%. meaning your medical costs had to be 80 to 85% of the premium. Administrative costs could only be 15 to 20, and it counted the commission for selling the product as an administrative cost, which meant the commissions weren't available to be paid. So what happened? All the people in sales in terms of group medical insurance got out of the business and went to selling something else. What happened because of that is the navigators came about. So we ended up hiring a bunch of unqualified, unknowledgeable, limited talent people as navigators to offer to try and sell insurance under the new exchanges created by the Obamacare Act. And what happened is sales of those policies were not very robust. In fact, it was very difficult for the president to get his minimum goal of 7 million people being covered. Why? Because the navigators weren't salesmen, number one. Number two, they weren't as well educated as they should have been, number two. And number three, the states did not really embrace it. So that's a private sector solution that had been used for years and years and years in our country, and that is independent agents making sales of independent insurance products to independent contractors. That's now gone away. They've got to go find an employee who is a navigator who has no incentive because they're on a salary and not a commission to provide the plan or to sell the plan. They merely are there to collect their paycheck and offer information if, in fact, somebody can find them. So my point is this. Ms. Burwell is taking on a serious challenge in terms of labor HHS. The Affordable Care Act presents tremendous problems in terms of access, in terms of cost, and in terms of quality of health care for the American people that will only get greater as the years go by. We're going to take somebody of her competence and her candid nature to help us join together to see to it that what has become a major problem that looms for our country, and that's the Affordable Care Act, is revisited to look at a new way to go back to the private sector, go back to competition, go back to a level playing field, and out of the business of selective taxation, less access, more cost, and more bureaucracy. That's what we have with the Affordable Care Act right now. That's what's untenable. I wish Ms. Burwell the best. I intend to be very aggressive and active in my work on the Health, Education, Labor, and Pension Committee and the Finance Committee to try and get to the bottom of some of the questions that have gone unanswered from the department. I wish her the best, and I hope I get the answers to those questions when she's confirmed as the new Secretary of HHS, and I yield the rest of my time.